So again, good afternoon. I hope you are feeling energized, but I promise you the 2 coming hours it will be so interactive and you will learn something new. My name is Saad and I'm the medical training manager for Loreal Dermatology Division. And under Loreal Dermatology Division, we have 4 brands: La Roche-Posay, CeraVe, Vichy, and SkinCeutical. What makes Loreal Dermatology Division different from all other divisions we have under L'Oreal Group, L'Oreal Dermatology Division different from the other groups under L'Oreal and other brands that we have, it's a division that is supported by medical evidence. And once we say medical evidence, this means clinical studies, clinical data, everything that is recommended by dermatologists to bring solutions for skin concerns and hair concerns. Okay? So in the coming 2 hours, we will talk about something that's very important, and you as pharmacists play an important role in it, which is the importance of a recommendation for skin solution when it comes to monotherapy, and what is very important when it comes to adjunctive therapy. So why we are here to understand the adjunctive therapy and the role of dermocosmetic in monotherapy. If you want to talk about adjunctive therapy, in your opinion, when it was the last time you recommended something else other than dermocosmetic in adjunctive therapy? For example, you received a prescription that has antibiotic. What will you recommend? What you will advise your client or your patient to use with antibiotics? Probiotics. And why it is important? Once we talk probiotics, it is adjunctive, right? It's not the main treatment, it's the complementary. Why? Why we recommend a complementary treatment? Why do you recommend a probiotic? Exactly, let's make it in very simple words, to reduce and minimize the side effects of the antibiotic. And this will help the client to have better results, and what else? And to be more compliant on the treatment. So when it comes to dermocosmetic, it's the same. We have the initial treatment if we are talking adjunctive. For example, you have a patient that the doctor prescribed for him Roaccutane or isotretinoin. What is the complementary treatment? You receive this prescription. What you will ask your patient to use? Moisturizers. Why you are recommending and advising moisturizers? Yes, so we are reducing the side effect to make the patient more compliant on the treatment and to have better results. So today I need you to have this mindset, the mindset of adjunctive therapy, when it comes not only to the treatment itself, the moisturizers, for example, or the shampoo, but when it comes to something that is very important, which is photoprotection. In the hospital or in the pharmacy that you work at, do you receive prescriptions that has medications which are photosensitive drugs? If I will use any photosensitive drug, what will happen? For example, antifungal. What will happen? My skin will be more sensitive to sun, so I will have sunburns. So what's our role here? To recommend photoprotection. Okay, doesn't this make sense to you? Yes? So nowadays, what is the most common skin condition that you see it every single day during your practice? Dryness, acne, eczema, sunburns. What else? So we see acne, we see eczema. We will tackle eczema today, we will tackle acne today, we will tackle dryness today. Sunburns, also we will talk about the sunburns. Pigmentation. And if we look at the prevalence of pigmentation worldwide, you will see that 50% of the population worldwide, they suffer from pigmentation. And 50% of this population, they have a very bad quality of life. If you know someone who suffering from pigmentation, they will always leave the house wearing makeup, right? Just to hide it. And they will feel that how they are perceived from the society and from the population or at work if they have pigmentation, because it's something that they wear it on their skin. So it's how people, they will see them, right? So what is our role as a pharmacist in improving the quality of life of those patients? So today you have a patient who came to the pharmacy, and during your discussion, he asked you to recommend a specific pigmentation routine. What's the first thing that comes to your mind? Please feel free to share so other than MelaB3. MelaB3 is very important, but once you look at MelaB3, what are you looking at? Cleanser, sun protection. But taking MelaB3 as product, what you are looking at in MelaB3, what's the expectation from the client, and why you are recommending MelaB3 in specific? Micropeeling agent, ingredient, so it helps in the exfoliating the skin. What else? What other, like I don't want to talk about a specific product, let us talk about ingredients. So Anna, I have a pigmentation. How can you help me? I'm expecting to see a very fast result because I don't want anyone to see my pigmentation. So how we can help in this part? What will we recommend? What will we advise? Maybe vitamin C, alpha-arbutin, azelaic acid, glycolic acid, niacinamide. So we are talking about different ingredients that have different onset of, that has different action, and they are all can help in treating pigmentation, right? Okay, so you said MelaB3. If I want to look at MelaB3 and to say why MelaB3 is efficient whenever it comes to pigmentation. You said it has exfoliating ingredients. Lipohydroxy acid inside the formula, so it has retinyl palmitate, so it helps to exfoliate. The MelaB3, it has, after 18 years of research, and after looking at all the molecules that are available in the market, and how, as La Roche-Posay, we can improve the quality of life for patients who are suffering from pigmentation, La Roche-Posay was able to discover the molecule melazil. Have you ever heard about melazil as a molecule? So melazil, you know everything that we said, alpha-arbutin, retinols, vitamin C, niacinamide, they are all active ingredients that treats pigmentation. And we have specific ingredients that inhibits the activity of tyrosinase, so the melanin production will be reduced, right? So why melazil is different and why it was an innovation? Because the onset of action of melazil, it works on the dipaquinone. So I have the melanocytes are active. There is production. I start to have the cell will produce melanin. So melazil will capture the precursors, and this will help whenever I stop the serum, the rebound or the relapse is minimal because I'm not inhibiting the enzyme, okay? So melazil as a molecule works in completely different mode of action versus other. But I need, as La Roche-Posay, to bring science and data and to convince you that melazil is really superior in whatever is available in the market, right? So you will have this confidence to recommend it. A study has been done, actually not one study, it's 14 studies. Among the 14 studies, 270 patients were enrolled in the study in order to prove the efficacy of melazil versus 13 reference groups, including the most effective one, which is hydroquinone, ascorbic acid, and all others, as well as niacinamide. So if you look at this graph, you will see that melazil has better result versus others. But again, I need to see how melazil is acting versus what? The most used molecule and the most effective one, hydroquinone. So I need to see how it's working. That's why a study has been done. It was a 3-month study, randomized 54 patients, MelaB3 as a serum versus hydroquinone. You can see here the purple one is MelaB3 and the light one is hydroquinone. You can see that there is no inferiority of hydroquinone on melazil, but what do we have? Better tolerability. So the patient will continue using the treatment because it is more like the side effects are less, the dryness is less. And this is very important, and this is very important thing whether I stop the treatment or I continue the treatment, right? But what I want to see as well, not only if it is more tolerable or it has inferiority or superiority, I need to see what will happen if I will stop the medication, if I will stop the treatment. And this is the main thing that everyone suffers from. This is a study after stopping the treatment. You can see the efficacy of MelaB3 after there is continuous improvement versus hydroquinone, where the relapse here is more, okay? Do you have any question? And here I need to see the onset of action. I said in the beginning, patients want to see very fast result. So when will you promise your clients that there is an improvement? As per the studies that have been done, patients can start to see a result from starting week 2. In 2 weeks, from day 1, you can see improvement, but the most significant one is at 2 weeks, okay? Also, to prove again that Melazil has superiority on other, it has been tested against the most fastest onset of action molecule. And you can see here, starting the 4 weeks, it is 2 times more superior than the whatever available in the market. That's why, as La Roche-Posay, Melazil was an innovation against pigmentation. But at the beginning, we said that, we said so many different molecules, right? You need something as exfoliatant. She's looking for alpha-arbutin. Others are looking for niacinamide. So it's not only one molecule that has all this, it is the formula behind the product. So if we look at the formula of MelaB3, you can see it has hyaluronic acid and glycerin. So with hyaluronic acid and glycerin, I'm hydrating the skin. I cannot keep the skin dehydrated. You have the Melazil with niacinamide, you have antioxidants, and you have lipohydroxy acid with retinyl palmitate that works on exfoliating the skin. So as the full formula against pigmentation, you can see the superiority, better tolerability, and the fastest onset of action. What do you think about MelaB3? Do you have any feedback that you would like to share with us? Have you ever tried the product? Did you hear any feedback from your clients? You can, if you've never used it, it's okay. How it is nice. Yes. What did you see different? When it comes to the texture, when it comes to the pigmentation? If you would like to share with your colleague, it will be exactly. So here, whenever we are the role as a pharmacist, whenever we are recommending a monotherapy or adjunctive therapy, is to build this trust with our clients. That what we are giving them is something beneficial for them, right? But if we, here are some before and after photos, melasma, and you see here that melasma is a mild melasma. We are not talking about very severe melasma. PIH as well, it's way more better with MelaB3 than the initial, than day 0. What is the main, and now if I want to ask you a question, please answer me. What is the main reason of having pigmentation? Sun, right? Sun exposure. Exactly. Sun exposure will activate the melanocytes, leading to the formation of melanin. We all agree on this. But if we look at the sun, here's the sun, right? We have UVB, which will cause sunburn. We have the UVA. But if we look at UVA, how many wavelengths we have? We have the short one and we have the ultra long one. And the ultra long one, as per the studies that have been done, we both agree that UVA is responsible for the activation of melanocytes, and for pigmentation, right? Pigmentation and anti-aging, correct? So, but if we look at the studies that have been done to understand the effect of UVA on our skin and on pigmentation, we figured out something very important, and this will make a change when we want to treat pigmentation and when we want to prevent from having pigmentation. We discovered 2 things. The first one is that ultra-long UVA and the impact on pigmentation and aging. So it's not only a specific wavelength of UVA, it is beyond the short wavelength. The second thing we've noticed, you know that the sun is made up of UV, what else? Visible light and infrared. Infrared, that's why we feel the warmth, the heat. The visible light, and in specific, the high energy visible light that ranges between 400 and 450 has a huge impact when it comes to pigmentation. As per the result, the data and the studies, it's 47% of the visible pigments that we see are related to the ultra long UVA and the high energy visible light. So how can you help your clients? In your opinion, just if you want to brainstorm together. You have the sun and you have the skin. Now you understand that if I need to protect my skin, what shall I apply? Sun protection, excellent. طيب, the sun has 3 major lights, 3 major sunlight, which is UV, visible light, and infrared. Data have shown me that UVA, the all ranges of UVA and the high energy visible light has a huge impact on pigmentation. How can you help me? Sunscreen. The sunscreen should include what? What is the best sunscreen in your opinion? It includes what? UVA, UVB. So you have to see that it's SPF 50 plus and it has UVA, okay? But I need to see also as per this, to solve the problem here and to help improve the protection efficacy, I need to protect you against ultra UVA. And that's why La Roche-Posay, after 10 years of studies and after filtering so many filters in the market, how can they protect us from the ultra-long UVA? They introduced the Mexoryl 400, which you can see it in all our sunscreen, Antelius UV-Mune 400. 400, it refers to Mexoryl 400, which filters this. So now I'm protecting my clients, UVB definitely, and all UVA. This will help to reduce the impact of UVA on my skin. But the second thing that we look at in any sunscreen, it's not only the filters and the SPF. We look at the technology. Why? You will hear so many clients complaining they don't apply sunscreen because it leaves white marks, because it's not sweat resistant. It migrates to my eyes and I feel like eye stinging, correct? During the weather and the sandstorm here in the UAE region, we feel like it's something too much sticky and it will be removed, correct? That's why we have in Antelius range the netlock technology where all the filters will come across, forming a net to give a homogeneous and make it water resistant, sand resistant, and it doesn't migrate to eyes, okay? So we solved two problems, the UVA and the texture and the resistance on the skin. The third problem, what it is, I just mentioned it in the previous slide, that is responsible for pigmentation, ultra-long UVA, that I'm protecting my skin by using Mexoryl 400. So Mexoryl 400 is protecting against ultra UVA. What's the second thing? Exactly, the high energy visible light. It's very important to see high energy visible light and not only visible light. So how can I protect from high energy visible light? I can use an molecule, actives. And as per the studies that have been done on Mexoryl 400 along with Melazil, it has shown that both together will help to reduce the efficacy of the impact of high energy visible light on pigmentation. So now what I want to tell you, the product that we have, the sunscreen that we have that completes the Melabi3 serum is Antelius UV-Mune 400 anti-dark spots, because it doesn't only protect you from UVB, UVA, it also gives better protection when it comes to high energy visible lights. Does now it make sense to you, the story of how can I give better results for my clients when it comes to pigmentation? Makes sense? Yes, no, agree, you don't agree, you cannot agree with me, we can have a discussion together. Yes? So now you have the cleanser, you have the serum, and as well we have the sunscreen. So it's a full skincare routine. So Melabi3 as a skin, how you will use it, it is recommended to be used twice daily. As per the results of the study, it has been used morning and evening time. Definitely cleanser also twice daily, and sunscreen as much as possible during day. The most important thing to always keep in your mind, whenever you are using Melabi3 serum in the morning, it has lipohydroxy acid and retinyl palmitate, so they are exfoliating. The skin has to be highly protected, okay, and not to be directly exposed to sun. Okay, even if the clients, and even if you are sitting in a room that's not like directly exposed, but we all know that UVA can penetrate windows and clouds. So it's very important to apply sunscreen, and in specific Antelius anti-dark spot if we have pigmentation. Okay, any questions before I end? Yes. So you are asking if patient has mild pigmentation and they are taking acretine. Yes. Just for the glow and just for. I spoke at the beginning that our role as a pharmacy and your role is to not only to give monotherapy, but also adjunctive therapy. What do you think? If you face this, if you have this patient, what do we recommend for her? Is it only acritine? You will tell her just use acritine at night. What you will advise her to use? Moisturizer is very important. Sun protection is very important. What else? We can add on Mela B3 because Mela B3, it's not only as a monotherapy, but I can add it on the treatment as well to make the patient more compliant, one. And whenever she stops the other treatment that she is using, she will not see relapses and to prevent it from new pigmentation to appear, okay? So yes, we can. The most important thing is to protect the skin very well and to use a proper moisturizer. Any other questions when it comes to pigmentation? Will you recommend Mela B3 serum as a full range for your client? Will you advise photoprotection? So as I told you, it's just for you as a refreshment and for you to remember that we have a huge range. It comes the Antellius fluid and comes in hydrating as well, the oil control, both the cream and the fluid, and the recent launch, which is the anti-dark spot. Okay? How many times you've seen patients asking for repairing solutions? Every day you see someone like they want a repairing. What you would recommend for them other than Cicaplast? And if Cicaplast, why Cicaplast? It's very nice for repairing. This is something that clients ask for. I need something that's very fast onset of action and the texture is nice, so I can reapply it. If you want to look at repairing, you have a repairing problem, a skin, like a scar, bite, sunburn. You see sunburn every single day, maybe. Why I need to recommend this specific product other than other? To reduce something you look at for soothing, maybe, yes or no? Something as anti-inflammatory, right? To reduce inflammation. Something to reduce the itching. So you look at things that reduce the side effects, correct? And correct the problem. So when it comes to La Roche-Posay, as you all said at the beginning, it is Cicaplast. And why it is Cicaplast? I will answer you why it is Cicaplast. Because it has panthenol, definitely. And panthenol calms the skin. And it has the Cica, madagasoside, that helps also in soothing the skin. It has the thermal water that rebalances our skin. And what's interesting, it has the prebiotic complex, the tribioma. Because now, whenever we have any repair, I need something for repairing, this means that our microbiome, the skin microbiome, is not balanced. And I need to rebalance it. So when it comes to Cicaplast, it's not only soothing. I will see the soothing, less itchiness, less inflammation. But what's most important thing that I'm rebalancing my skin condition. Does it make sense? So Cicaplast, you know that Cicaplast is recommended to more than 27 different indications, including sunburn, including diaper rash, including bites, including what else, Roseanne? What else is recommended? Post procedures, after laser, Morpheus. So now you have, after all aesthetic procedures, also for babies, you can it's data and science that recommends Cicaplast from day 0. Any procedure, any wound like tattoos, sunburn, invasive procedure to the skin, microneedling, Morpheus, laser, whatever procedure that I need my skin to repair, I can easily recommend Cicaplast because always keep in your mind what you are advising your client is not only to reduce the side effect and to minimize it. In my mind, it's not only the inflammation, it's also the repairing and restoring the skin condition when it comes to our microbiota. It makes sense? Yes, because it's not only giving the relief effect, but it's also repairing. And that's what's important. I don't want only to relieve. I need to give something that repairs and restores. Cicaplast, it comes in the Cicaplast Bomb B5, this one that everyone is aware about it. And recently they launched Cicaplast Gel B5 that comes with silicone. And this is mainly for clients who did any surgery, they have stitches and they need you need something to repair the stitches because it has silicone. The repairing is fast, okay? Also for post-fractionated laser or Morpheus, because it's too much deep and there is wounds, you can go to Cicaplast B5 because it has silicone inside, okay? And it's a gel form more than not creamy form. So gel, it will, and because it has silicone, so you feel like there is an occlusive, what I can say, occlusive shield on your, layer on your skin. For the scar after C-section, yes, it can help. Yes. For stretch marks, it depends. There is no data that shows its efficacy, but when it comes to stretch marks in specific, it's a holistic treatment. So the client has to do lasers, Morpheus. It helps in repairing, but not on treating. And you cannot count on it as a treatment. Okay? Rosanna there.
Can I just add one more point?
Yes.
Because there is like a misunderstanding for the product. Sometimes patients see on TikTok videos or whatever, someone recommends for them to use the Cicaplast as a daily moisturizer. Yeah. And then they come at the end complaining of acne. Thank you. Yes. So please just let any patient who's willing to purchase the Cicaplast gel or the balm to use it when needed, when they have the indication for like, I don't know, 4 or 5 days, 1 week, but not to use it daily as a moisturizer because this is not the main indication and it causes acne. So yes, please.
So we can consider it like it's treatment cream, right?
It's a treatment cream, it's a healing cream, and there has to be an indication for it to use it, not like a daily moisturizer or not like the serums. Mainly not like Effaclar H. If you know Effaclar H, it's a daily moisturizer for oily skin and acne-prone skin, so not Cicaplast. Okay. But that's it.
Thank you.
Yes. Always clarify to your client that if I need...
2:45. 5 minutes.
Okay. Always you can explain for your clients if they are using a specific... What's the objective of the treatment? I need Cicaplast as a moisturizer. If it is as a moisturizer, then it is not the solution. If it's not a moisturizer, then Cicaplast is not the solution. If what I'm asking for is I need something for the sunburn, if something for post-procedure, rashes, bites, yes, Cicaplast is the answer. And why I cannot use it as a daily moisturizer? Because at the end of the day, it's the ingredients. Who will apply B5 every single day if I don't have inflammation? And a very thick cream. So I will be happy of the results this first day, the second day. But after that, my microbiome is not balanced. So I will see acne. Maybe it will close the pores if I'm oily or acne prone skin. Okay, so always try to understand the needs of your client. Based on that, make them they will change their mind whenever you explain why it is not Cicaplast, why it's something else. So before I go to the other skin problem that you mentioned, you see it every single day, we will take 10 minutes break, 15 minutes break if you would like to grab some coffee or some bites, and then we will continue. Okay.